Welcome back. May is National Blood Pressure Month, and according to the American Heart Association, about half of Americans have high blood pressure.
But even more concerning about that is people who have high blood pressure often don't even know it. Dr. Aman, an interventional cardiologist with UT Health Houston Memorial Hermann, joins us this morning to talk more about it. Welcome. Thanks for being here.
Thank you so much for having me.
That's what's scary, is a lot of times people can't tell. You think that you might have a racing heart or something, but what are the typical symptoms of high blood pressure, if any?
You know, that's the scary part. There aren't very many, and so that's why raising awareness is so important. See, the numbers are staggering and sobering. 100 million Americans have high blood pressure, and guess what? About 50% of them are unaware. More sobering is that about 1 in 4 people have good control of their blood pressure. And so it's imperative on all doctors, especially our cardiologists, to raise awareness about this prevalent disease.
So what exactly causes high blood pressure in a lot of folks?
Interestingly, so there's something called primary hypertension, which is genetic, and it's over time thickening of your heart vessels and your arteries that can cause high blood pressure. And there are a plethora of other reasons why you can have blood pressure, including some over-the-counter medicines, hormonal issues. And so it is up to your doctor to really talk to you and understand why you have high blood pressure.
Well, sometimes people can go into a doctor's office and they may have what's called white coat syndrome, right? Where they're fearful of this, or their blood pressure may shoot up. So it's important to do it in the comforts of your home. How often do you want someone to do it? And do you want to demonstrate here how easy it is to do at home?
Absolutely. So, I mean, yes, we check it in the clinic all the time, but sometimes the clinic is rushed. There is a lot of anxiety along with this. This can sometimes be scary. And so in the comfort of your home, before I put this on, I want to say 30 minutes before you check your blood pressure, no exercise, no caffeine, absolutely no smoking. You want to sit down for about 5 minutes, calm, quiet place at your home, and then you take your cuff. These cuffs are available at all pharmacies. So just, you know.
So we're not doing this right after we get home from rush hour and driving for, you know,
no, that's
forever all
the best
frustrated.
thing to do. Exactly.
So
and just that way. And just you press the buttons. I typically tell my patients, you know, disregard the first reading, take the second one, or average it out. The more you check, the better we are equipped to, as doctors, treat this. I always tell them more data, better for us. And so, yeah, absolutely, just take care of yourself, check your blood pressure, keep a log, and talk to your doctor.
And how exactly do you treat high blood pressure? So
the first step is always going to be changing your lifestyle, cleaning up your diet, making sure that you are getting rid of your processed foods, reducing your sodium, increasing your potassium, and then the next step is obviously exercise. The American Heart Foundation recommends about 150 minutes of moderate intensity exercise a week, but quite honestly, anything is better than nothing, so start moving.
It's so important for people to realize heart disease, #1 killer, men and women, and this is something that we can try to take control of. Can you explain to someone why and what happens if you don't get that blood pressure under control?
Blood pressure is something that can affect almost every organ, but specifically your heart. It can cause heart attacks, heart failure, it can cause strokes. It is devastating on the kidneys. People end up on dialysis because of uncontrolled high blood pressure. Really bad for your eyes as well. But
the list goes on and on.
Oh, it goes on. There's good news, though. So dropping your blood pressure by 10 points reduces your heart attacks by 15%, a stroke by almost 25%. Wow. So there's a lot of benefit in catching this early and then, you know, really trying to get ahead of it and trying to control it.
Great information. Thank you so very much.
You are very welcome. Thank you so much for having me.